Imagine a creature loses an eye. Instead of regrowing it, a long sensory antenna sprouts outward from the empty socket. Consider an amphibian with a severed limb. Cells at the wound site divide, multiplying into two fully functional legs from a single stump. This process is known as regeneration, the biological formation and recreation of a cut or damaged body part. Lower animals, such as certain worms and amphibians, possess high regenerative capabilities. Conversely, higher animals have almost none. This capability is also limited by time. As an animal ages, its ability to reconstruct tissue decreases significantly. Regeneration is an active biological construction process. It is governed by an organism's evolutionary rank and its age, making it distinct from the simpler healing processes that repair minor skin damage. When the biological process works flawlessly, it is called epimorphosis regeneration. This is the standard mechanism where the body rebuilds the exact missing part. If a lizard loses its tail, the organism reconstructs a replica that matches the original structure. This precision is visible in the salamander's forelimb, where the body restores bone, muscle, and nerve tissue to their original complexity. Successful regeneration relies on a biological code that maps the geometry of the missing part and instructs the cells to stop once the reconstruction is complete. When the body's internal blueprint overcompensates, it results in a glitch called super regeneration. A single cut on a salamander's leg can trigger the formation of 2 or 3 complete appendages instead of 1. Another error is heteroregeneration, where the biological code replaces a lost organ with a different structure. This explains an insect growing an antenna where an eye was. Cells receive the signal to build, but execute the wrong instructions. Scientists also categorize morphollaxis regeneration as a separate variation, where existing tissues are remodeled into the missing part. These growth errors demonstrate that regeneration is driven by active cellular instructions. When those instructions are misread, the organism constructs a mutation rather than a repair. The efficiency of these cellular instructions is dictated by specific external and internal environmental factors. Regeneration rates increase with specific variables. High vitamin A, low potential electric currents, high oxygen, and elevated temperatures all accelerate tissue growth. Nutrition acts as quality control. Without adequate food, the regenerated part forms, but its overall size diminishes. When fuel is scarce, the body prioritizes the completion of the physical structure over matching the original scale of the missing part. While certain factors accelerate growth, other biological inhibitors can stop the process entirely. Exposure to X-rays terminates cellular regrowth, preventing the animal from initiating any regenerative repairs. There is also an absolute neurological requirement. If the nerve connecting a limb to the central nervous system is severed, regeneration stops instantly. These factors show that the nervous system is the primary regulator of the regenerative process. The growth of new tissue depends on these neural connections remaining intact to provide the necessary instructions for reconstruction.